All right, I got the recording. Got Leslie in the room.
Wonderful. Welcome, Leslie.
Hi, everyone. Good to see you. Hello, hello.
Hello.
All right, it is 1 o'clock and we have a packed meeting. Hello, everyone. My name is Dr. Chelsea. I serve as the program manager for the Region 10 Opioid Abatement Council, Gateway to the Rockies, also referred to as GROC. Our agenda today, we're going to do our introductions, attendance, and quorum. We'll approve our last meeting minutes from 4/28. We'll discuss conflicts of interest for today, a brief finance report, general updates from me. I will briefly review our paradigms, a strategic plan, community listening tours to ground us in the work. And then we are going to head straight into RFA discussions. And then if you are in person, we have packets for you. If you are joining us at home, there was an email sent out to that restricted Google Drive with the application materials. Remember, I will start with a 4-minute overview of the application. And then each of the people who scored the application will have 3 minutes to go over their scorecard, bring up any general points of concern. Then we will move into 4 minutes of open discussion. And then we have our next meeting. We have an executive committee meeting on May 19th. And then we'll have roughly 2 weeks off. We'll have our next meeting on June 9th, virtual only. So there is a QR code on the screen. If you are a non-voting member, please check in using the QR code. Commissioner Del Kemper, are you here?
Yes, I am. Hi, everyone. Good to see you.
Commissioner Marlin. He was going to join a little bit late. We'll circle back to him. Commissioner Hollingsworth is not here. We have Commissioner Aiken. Yes?
Yes, that's me.
All right. Michael Prang?
I am here.
Heidi McCollum? Stephen Potts? Sheriff Armstrong? Alternate Greg Demo? Demo, thank you. No one's ever corrected me, thank you. Mayor Bud?
I'm here, thank you.
Janine? Here. Troy Cooper or Tori Jantz?
Troy Cooper's here.
Thank you. Dr. Story or Michael Miller? Dr. Ryan or Emily Cooper? Elisa Witt or Marie Larson?
Hi, Marie is here.
Thank you. Mary Berg or Barb Weinstein? I did not say that right, did I?
What, my last name?
Yeah.
It's Weinstein, but it's fine.
Weinstein, okay. It didn't sound right as it was rolling off the tongue. Sarah Kasna or Dr. Gillingham?
I'm here. Yep.
Sorry, I botched up your name too.
That's okay.
I'm getting married in 9 days, so my brain isn't here, folks. Janie Barker or David Jocelyn?
This is Janie, I'm here.
Thank you. And then Kristen Heath was coming late.
Alrighty, we're at quorum currently with 10 voting members present.
Okay, did you get Commissioner Marlin?
We are at quorum with 11 voting members present. Thank
Okay.
you.
On the screen. All right, we have an approval of 4/28 minutes.
This is Leslie. I'd like to go ahead and make a motion to approve the minutes from April 28th.
We'll vote by opposition in the room or in the chat. So many pages. All right, the minutes have passed. And then we're gonna go over 512 conflicts of interest.
William Sheriff's here an application.
Oh, I have a conflict with the sheriff's application. I missed that on the agenda, sorry.
Do they only have to say it if it's in the active agenda? Or
No, actually,
still RFA?
it's still any individual who represents an entity that receives GROC funds should mention that. Doesn't mean you can't vote. It's just
Yeah.
so everyone knows.
Yeah, so every meeting, just because it's not in the agenda, you're still applying.
Okay,
So you're just gonna have to disclose it every time.
so every single time. I was
Yeah.
looking at the agenda. Thank you for the clarification.
Yeah.
And Chelsea, this is Leslie. I think I believe I also have a conflict because we have at least two Jeffco organizations with the Sheriff's Office and Public Health as well. Applying
Yeah.
for funding.
Clear Creek also receives funding, so that would be Commissioner Marlin, Janine, Dr. Ryan, and Sarah. Oh,
I mean, I don't represent the county.
no, you don't represent the county. So
Okay,
it's just
so
3 for them.
Okay,
What about Gilpin?
Gilpin also receives funding.
So should I have a conflict?
Yes.
Okay. All we need to do is announce that you represent Gilpin, which receives funding.
Chelsea, this is Mayor Putt, and I have a conflict with the two Jefferson County items. Or,
And the Wheat Ridge also receives funding with JCMH for the corresponder program. Yes, George. Are you there, George? Your hand is up, but I can't hear you. Oh. Nope, still can't hear you.
Can you hear me now?
Yeah.
Whoa. Okay. Thank you all. Sorry about that. I'm having a technical issue. Yep. Just announcing Clear Creek received funding. It's not on the agenda now. Just a disclosure.
And then voting or non-voting members who used the QR code to check in, we have Erica Hag. She's an advisory board member, and then she's also on the board of directors for Resilience 1220 and Echo, who both applied for funding. Sharon Hawkins is an advisory board member with Jefferson County Public Schools, an RFA reviewer, no conflict of interest to report. Sean Henley is the CAO of Red Rocks Recovery Centers, advisory board member, RFA reviewer, and they applied for funding. Theodora Bartuski, grant writer, Colorado Coalition for the Homeless, no conflict of interest. Amber Qatar, quality outcome program coordinator at Common Spirit Health, advisory board member, RFA reviewer, no COI to report. Oh, Michael Miller's in the building. Okay. Harm reduction program manager with Jefferson County Public Health. They did apply for funding. Michael Miller is also on the executive committee and an alternate to the voting board. Brian Thierry, an executive director of Guardian Recovery, advisory board member, no conflict of interest to report. I can copy and paste that in minutes too. Okay. Brief finance report. This is maybe like 2 weeks old, but pretty up to date. Co-responder 2025 plan was $277,196.69. On the screen, it does show you what we've paid out for JCMH, Clear Creek, and Gilpin County. And then we have a planned balance of $191,305. For recovery community, our planned budget was $597,163. We have a balance of $517,086.67. And then for our planning and coordination bucket, we have $1,348,278.94. And then our planned balance is $1,366,953.94. Some funding changes, reductions, and repeals at the legislation level, just to keep on people's radar. There was a repeal of the Recovery Friendly Workplace Certificate Program in the Center for Health, Work, and Environment at the Colorado School of Public Health in the amount of $412,000. They eliminated funding for the perinatal substance use data linkage project. There was a repeal on school mental health screenings for 6th through 12th grade students, partly due to underutilization. There was a reduction in funding for the University of Colorado MAT expansion program. There was a reduction to BHA appropriation for treatment and detox programs. And then there was a decrease of 11% in state Medicaid funding for substance use recovery peer services in the amount of $20 million. To date with our RFA buckets, we started with a little over 11.2 million. We did commit to those 2 renewals. And so our balance is $10,143,456.06. Some general updates from the executive committee, the R&R reviews. Monarch Recovery did advance to the June 23rd budget day. The R&R budget in the restrictive Google Drive is specifically for the house in question. That's not the entire business operating budget. I misspoke before. And the Mayor Bud had proposed, instead of engaging in a capital agreement, that we just paid rent scholarships. That option is not available because the owner of the home is interested in selling the home now. So the only 2 options would be the full house payment, the down payment. I guess the 3rd option would be not to fund whatsoever. The Jeffco biometrics application did advance to June 23rd with a strong possible funding of only 50 units instead of 100 units. And then the Jeffco public health application also advanced to June 23rd with a conditional fund to do the needs assessment and then revisiting the contract and outlining some specifics. So just keep in mind when you're reviewing those budgets. And then on June 17th, Amber, Chris, and I will get together and piece different variations of the budget for you folks to see. Yes, Commissioner Marlin.
Thank you. I just want to clarify. I don't think the executive committee did anything more than allow the conversation to continue on these. I don't think we have made any determinations for the larger body like JCPH only getting a certain amount of funding or anything like that.
Right. I was just putting those ideas out there. So when people wanted to look at the budgets, they would have those in mind. Sorry, I should have clarified that. No decisions to make. They're just advancing. And then we did again update that the 2025 Opioid Abatement Conference is scheduled for October 27th at the Embassy Suites in Loveland in partnership with the Rethinking Addiction Conference, October 28th. That's all the information I have, but more information will be coming as I learn that. Final reminder that the COAG meeting about transplanting or supplanting funds is defined as to deliberately replace funds because of the receipt of opioid settlement funds. Opioid settlement funds should be used to create, supplement, maintain, and or expand program activities, not replace those funds that have already been appropriated or allocated for the same purpose. All right, final reminders of our paradigms. We can look at addiction recovery in 4 different ways. A moral paradigm being drugs are bad and people who use drugs are bad. The social paradigm is that environmental factors create substance use disorder. The identity paradigm, I always think of like Blackout Becky. So you adopt the paradigm of having to identify with your addiction and your identity. And then the disease or medical model of addiction is that addiction is caused by physical, mental, or genetic deficiencies or abnormalities. No one paradigm is superior. They are all relevant and important to the conversation. When we first did the paradigms review, the council was split in half. Today we are mostly talking about treatment, so that is going to be mostly the disease model. So if that wasn't your primary, make sure that you are thinking outside the box. I did add this slide of our funding priorities that has the dollar amounts associated with prevention, treatment, recovery, harm reduction, and planning and coordination. If people wanted to go back and review this slide. As a reminder, these are not hard and fast buckets. We can file an amendment to change the dollar amount based on the applications and types of applications that we receive. So the strategic plan, the focus for prevention was youth and community wide. For treatment, it was outpatient transitional care from incarceration to community, MAT, MOUD access across the continuum, and inpatient residential treatment or supporting housing with treatment. For recovery, the focus was on housing, recovery support services at the community-based response level or growing peer-to-peer supports and services, and then transportation, both inter and intra-county round trip. Harm reduction was a comprehensive harm reduction suite, full care. Planning and coordination was broken up into 2 categories. The first one being management. So that would be like my salary and fringe, our upcoming RFA for program evaluation, and then our emergency fund, which is open outside of the RFA window. And then for the purpose of this RFA, we focused on workforce development. So continuing professional education models, recruitment, hiring, and retention of the workforce, including clinicians, peers, and harm reductionists. And then workforce training access, including MAT, MOUD, mental health, and trauma-informed care. From the community listening tours, Jefferson County placed emphasis on transportation, Medicaid subsidies, and collaboration with Adams County for sober living, and then a collaboration with treatment centers within the county. Gilpin County focused on Narcan accessibility and trainings, first responder resource reimbursements, generating data, youth prevention education in schools, and a collaboration with Region 6 Boulder County to address how the school district is split up. And then in Clear Creek County, there were conversations around stigma, around mental health and substance use, unknown data variables, especially around stigma, interest in co-responder program, youth programming, local treatment opportunities that consider stigma and financial barriers, and syringe exchange programs. These are not all-inclusive lists. These were just topics of conversation from the community listening tours. Today we are in group discussion number 2. The focus is treatment. We do have one recovery group thrown in there just to keep things spicy. On Monday, we'll have our executive committee completely virtual, and we will review any revise and resubmits requested today. We did cancel the June 2nd executive committee meeting. The next full council meeting will be Monday, June 9th. We'll talk about recovery and prevention. This will be the final group discussion day. On Monday, the 16th, we will review, revise, and resubmit from the June 9th meeting. And then on Monday, June 23rd, we will review budgets of applications and make final decisions to fund, partially fund, or not fund. As a reminder, in the group discussion format, I will provide a 4-minute overview of the application, addressing any weaknesses from the scorecards. Then each person who scored the application will have 3 minutes to review their scorecard. You can deviate from it, bring up points of concern, and then we will have 4 minutes for general discussion. Anyone from the floor is able to speak at this time. Then we will have a vote to advance, not advance, or request a revise and resubmit. And just to clarify from our previous meeting, the revise and resubmit should only be used if any outstanding questions will change your vote to fund, partially fund, or not fund. Still, please bring up any possible ways that you want to conditionally or partially fund, so I can go back to the applicant and make sure that that works. Address any outstanding legal questions. Any questions on this? All right, our first application is going to be Recovery Works. Our speakers are Dr. Ryan, Kevin, Kristen, and Sean. And I'm going to put 4 minutes on the timer. Recovery Works is a nonprofit organization based in Jefferson County, dedicated to providing recovery services, bridge housing, and medical respite services to individuals experiencing homelessness. They established in response to the 2020 Homelessness Action Plan. Recovery Works aim to address the intertwined issues of homelessness and substance use disorders. Their application requests $570,735 over a 2-year period for the All Roads Recovery Program. This 2-year initiative focuses on expanding recovery services for individuals with opioid and other substance use disorders, particularly those experiencing homelessness. Their 3 primary objectives are to provide MAT transitional housing to at least 36 individuals over the 2-year period, facilitate at least 10 weekly recovery-focused support groups engaging 180 unique participants, and assist 200 individuals in securing stable housing. Their target population in 2024, Recovery Works served 1,141 individuals, which represents a 295% increase from 2023. Most of their individuals have low income backgrounds, with 30% below the area median income. 47% of participants identify as BIPOC, Black, Indigenous, and people of color, compared to 23.5% of Jefferson County's general population. An estimated 70% of the homeless adults served have past or current involvement with the justice system, and approximately 37% of participants self-reported mental health disorders. Strengths of the proposal: it's an established organization. They have a proven track record and established programs in the community. The proposal details a multifaceted approach to address the needs of the target population. And they have collaborations with local agencies that enhance program feasibility and resource availability. Weaknesses and additional information, additional comments from the scorecards that are addressed in the narrative document. There's limited detail on financial stability post-grant. This is addressed in the narrative document on pages 1 through 12, where the applicant discusses resources available to the organization. The budget template also includes an extensive list of services in kind or financially matched to the program. There's timeline ambiguity in year 2. The narrative document, page 14, includes an evaluation-focused timeline for year 1 and year 2 activities. The work plan, tab 2 of the budget template, provides additional milestones. The council can request a more explicit timeline, especially during contracting. My guess is that year 2 is highly dependent on year 1 and would require a contract amendment to explicate deliverables after the year 1 data analysis. Equity strategies could be more specific. The application notes high rates of BIPOC engagement and justice involvement, but could provide clearer actionable steps for promoting equity. And the council can request this be explicated now or during contracting. The evaluation plan has several key indicators. Generally, this is a good initial plan, and the council is encouraged to allow me and the awardee of the upcoming program evaluation RFA to engage in capacity building around the evaluation plan. The budget contained only 3 line items: personnel salaries, client needs, and the 10% admin, for the total of $570,735 over the 2-year period. They do provide a partial funding option of $310,000 over the 2-year period. One reviewer suggested partially funding 400,000 of the 570,000 request. And then I will yield the floor. Dr. Ryan.
Thank you, Dr. Shore. My summary, obviously this is a 12 suited applicant in terms of they have a long history of doing this work. They serve a very important population who is oftentimes served by their application. And my only concern around their application is it serves a very specific geographic location themes and doesn't really address issues of homelessness in Clear Creek and Gilpin. But that aside, I don't have any hesitations with this specific application in terms of what they're requesting of the money and what they're planning to do with it. As stated, I think their evaluation plan is solid and it's quite patient.
Are you yielding the floor?
I yield all my time back to the
All right.
from Jefferson County.
Kevin. Kevin Armstrong in here. In Kevin's absence, I will read his scorecard. Kevin said that Recovery Works' mission is to provide access to resources, community, and recovery with the Jefferson County's unhoused neighbors. They were established in 2021 in direct response to the Jefferson County 2020 Homelessness Action Plan and annual point-in-time data. In 2024, they served 1,141 individuals, a 295% increase from 2023. This increase highlights the gaps in Jefferson County for those experiencing homelessness. Individuals or families experiencing homelessness face disproportionately high overdose risk and struggle to access critical treatments. The Recovery Works All Roads Recovery Program uses evidence-based approach tailored to break down the barriers faced by unhoused individuals recovering from substance use disorders and the cause and conditions of homelessness. Recovery Works uses the SAMHSA's 4 pillars of recovery: housing, health, community, and purpose, offering support at every stage of the addiction recovery journey. Their program includes transitional housing for individuals undergoing MAT treatment, behavioral health counseling, recovery and housing focused case management, peer support, harm reduction services, and community building through diverse recovery focused groups. Recovery works closely with Jefferson County Workforce Center, as well as the Jefferson County centric organizations focused on recovery and homelessness. They service all racial ethnic groups. They focus on employing a diverse workforce to support their mission. The budget request is $570,000 for 2 years. 3 strengths: they're an established organization with 3 vital programs in Lakewood, the Navigation Center, Bridge Housing, and medical respite programs at Mountain View. They present a comprehensive grant application with great detail and statistics specific to Jefferson County. They provided detailed synopsis of their program and services provided to those experiencing homelessness. 3 weaknesses were not identified. Additional comment says that Recovery Works presents a comprehensive and thorough grant application. The need to support individuals and families experiencing homelessness has only grown, as indicated by the 295% increase of individuals served in 2024. The correlation between substance abuse and homelessness is well documented. Recovery Works is a step in the right direction to combat this crisis. I would recommend full support of the program and its requested budget of the total amount. Is Kristen Heath here? Sorry, you're hearing my voice a lot today, folks. While we wait for Kristen to join us, I will go ahead and read her application for today. The program is an initiative aimed at supporting individuals recovering from opioid and substance use disorders by integrating stable housing with comprehensive recovery services. The program transitions unsheltered homeless individuals into housing while providing on-site support. Services include MAT combined with stable housing, where homeless individuals undergoing MAT receive behavioral health and primary care screenings before transitioning to housing under healthcare provider supervision. The program also offers on-site behavioral health services, including mental health counseling and support groups. Peer-based case management combines multiple treatment modalities to provide person-centered support in housing stability, vocational aid, and addiction recovery. Additional services include harm reduction efforts, peer-led recovery community groups, and vocational programming. Staff are trained in trauma-informed and strength-based care to ensure holistic support for participants. 3 strengths of the proposal are that the proposal demonstrates a clear understanding of the target population and how to address the needs of multiple vulnerable populations. It utilizes a variety of community partners to provide comprehensive services. Staff are experienced and well qualified. Only one weakness was identified. Seeking sustainable funding is mentioned, but there's no clear plan outlined. And that was it. Sean, are you with us?
Yep.
All right, 3 minutes on the clock for you.
Okay, I'm just gonna read through my my application that I wrote here. Recovery Works is requesting funds to launch their All Roads Recovery Program, their 2-year initiative aimed at expanding recovery services for people experiencing. I'm gonna fast forward because you guys have heard that 3 times now. One thing that I thought was great was that they're collaborating with Stride Medical, Jefferson Center, and Points West Harm Reduction. Also that the application or the program was grounded in SAMHSA's 4 pillars of recovery: housing, health, community, and purpose. It seeks to close critical service gaps by targeting individuals with co-occurring disorders, justice involvement, and significant barriers to care, particularly among BIPOC and low-income populations. Also, I guess this kind of gets into the strengths, but the program's leadership team includes experienced professionals in behavioral health operations and homelessness services, and that they had multiple letters of commitment from partner agencies. The 3 strengths that I listed were clear alignment with GROC priorities. I don't think I need to expand too much on that. I mean, it seems like it really fits exactly what this committee says its values are. And again, with experienced leadership and strong partnerships, the bio sketch and staff list reflect deep expertise in addiction treatment, housing, and behavioral health, collaborations with Jefferson County agencies such as Stride, Jefferson Center, Just Living Recovery, Reinforced Program, feasibility, and credibility. And also, lastly, they have a robust evaluation framework. They list multiple assessment tools and structured feedback loops, and have a solid plan for performance measurement with specific outcome targets. And weaknesses, try to go faster. Their year 2, this was already mentioned, but their year 2 timeline was a little bit ambiguous compared to their year 1. And I thought having more specific deliverables and growth benchmarks would improve the clarity there. There was it seemed like compared to other parts of the application, there was limited detail on financial sustainability post-grant. They definitely mention a few methods that they're looking for sustainability through Medicaid billing and AmeriCorps, but just a more concrete plan I thought would benefit them. Equity strategies could be more specific. They note high rates of BIPOC engagement and justice involvement, but they could provide clear, actionable steps to promote equity. And again, what was mentioned too, this is kind of just focused on Jefferson County, so that could possibly be expanded. Ultimately, I thought based off of the available budget, that partial funding of $400,000, given the little bit ambiguous nature of year 2 goals, would be appropriate. That's all.
The floor is open.
I wanted to bring up, they were talking about by the 2nd year, having provide treatment to 100 individuals in the Idaho Springs facility. And I'm just wondering what and Gilpin, I imagine, could be included in that. But as far as how many clients there might be in between Gilpin and Clear Creek. I'm not sure if that would be sustainable.
This application does not mention Idaho Springs.
Oh, am I on the Recovery Works?
Yeah.
I was looking at their evaluation plan. Okay. The one on the page I had.
With the green headings.
I was looking at this thing here.
Yeah.
I got this off the website. So. Oh, no.
And that one, I have that one.
Okay, so. This page here, you guys have that enough?
That one.
So. Did I get the wrong?
This is for the next one.
I'm sorry.
That's okay. Yeah, if you stick to the packet that I gave you, you'll stay in order.
All right, pardon me.
My question, this is Amber from Common Spirit. My question is in response to a comment I heard from a reviewer about it being unclear whether or how they would expand outside of Jefferson County, but did their proposal specifically say they were only targeting service area of Jefferson County and not intending to have their service area outside of that boundary?
Yeah, this application is strictly for Jefferson County.
Okay, I just want to make sure, because I heard a reviewer earlier mention it was unclear how they would serve the entire region, and I didn't know if that was ever mentioned of any effort to expand. So thank you.
George.
Yeah, first off, I support advancing this application. Similar question to others around this sort of regional question. I want to point out that the 2023 point in time survey counted 8 unhoused individuals in Clear Creek County. And there's kind of a lot of mobility across county lines as unhoused folks seek services and safety and et cetera. I think we should be asking them if they're willing to make residents in Clear Creek and Gilpin eligible for their services. I'm not talking about building a facility up here or anything like that. And looking at the clock, maybe I'll just make a motion, we advance this application.
This is Leslie. I'll go ahead and second that.
We will vote by opposition in the chat or in the room. Motion is to advance the application to June 23rd, budget day. All right, this application has passed. We are going to go into Denver Recovery Group. The speakers are Dr. Ryan, Janie, Bud, and Sean. Denver Recovery Group is requesting $618,082.96 for a 2-year budget. They submitted a proposal for grant funding aimed at addressing substance use disorder in Clear Creek, Gilpin, and Jefferson counties. The proposal outlines a 2-part initiative to establish a new medication unit in Idaho Springs, Clear Creek County, and expand operational hours at the existing Lakewood opioid treatment program. The Idaho Springs Medication Unit will be the first facility in Clear Creek County to provide methadone and buprenorphine treatment integrated with counseling and telehealth services. The Lakewood expansion would extend operational hours to accommodate more clients, improving access for those with work or family commitment. The primary goal is to expand access to OUD treatment, opioid use disorder treatment. They do provide short-term, midterm, and long-term objectives. In the short term, they would secure a facility for the Idaho Springs Medication Unit by the end of month 3, hire on board 4 key staff members, and expand weekday operational hours in Lakewood from 1:30 p.m. to 6 p.m. In the midterm, they would begin operations in Idaho Springs by month 9, serving at least 10 individuals in the first 30 days. They would reach and maintain 25 consistently served clients each month at Idaho Springs by the end of quarter 4, and they would implement Sonora remote dosing technology by month 13. In the long-term objectives, they would provide treatment to 100 unique individuals at the Idaho Springs location by the end of month 24, with at least 25 engaged in care at any given time. Maintain a 60% or higher treatment retention rate among Idaho Springs client by month 24, and contribute to a measurable decrease in opioid-related deaths in Clear Creek and Jefferson counties by expanding access to MOUD. They do provide target population information that is in my notes if you would like that more specifically. But the big service gap is just that neither Clear Creek nor Gilpin County has local access to methadone or comprehensive MAT services, forcing residents to travel long distances for treatment, which poses significant barriers, especially for low-income populations and those without reliable transportation. I am going to voice this for Lisa because I know she's not here, is that they do have the MAT truck that hasn't had a lot of service in Gilpin at least. And then summaries of strengths. There is an experience in infrastructure. They have extensive experience in providing treatment across Colorado with a strong operational framework. The proposal directly targets significant treatment shortages in the region, and they do have plans for ongoing funding through insurance billing systems post-grant. In terms of weaknesses, there is a limited focus on prevention and community engagement. The concern is indirectly addressed in the narrative under the prevention section, where it discusses community-wide initiatives aimed at reducing stigma, engaging all age groups, heavy resilience on a single point of leadership. Oh my God, to make me just get out of order. I'm going to yield the floor with 30 seconds left to Dr. Ryan.
Thank you, Chelsea. So I'm not going to reiterate what you've already stated. My biggest hesitation with this particular application is that Clear Creek also has a MAT van that is here on a weekly basis through JCMH with little activity at that. So their numbers in terms of the people they intend to provide services for of 100 individuals over 2 years seems grossly out of whack in terms of where those individuals are coming from, given the limited use of the MAT van that already exists in Clear Creek County on a weekly basis. So I don't know. I would be very interested to understand where they get those estimates and where they get the make the statement that there are no current services either in Gilpin or Clear Creek. I'm not saying they're entirely comprehensive, but there are services, and I can't imagine they would have serve 100 people in 5 years, let alone 2. So I yield my time back.
Janie.
I echo some of what Dr. Ryan has said. There is a MAT van that does come to Gilpin County. I think it's once a week. I'm not sure what the usage of that is. I've heard people say it's great. I've heard people say that not very many people use it, so I don't know. I thought their plan was very well thought out. It's an established organization that has a good track record, and their proposal does continue to support the Gilpin County Jail Program, where they offer MAT services for those that are currently incarcerated. And the weakness that I found was that nothing really directly in Gilpin County for people who are not experiencing incarceration, but Idaho Springs is pretty close. But again, we suffer from transportation barriers here, so that's another concern. Overall, I think it's a great program for Lakewood and possibly for Clear Creek. Doesn't do a lot for Gilpin.
Mayor Bud. Batteries. Oh, he had.
I'm not, I think you
Okay.
said it was, can you hear me?
Yes.
Anyway, I can't hear you, but I'll go ahead. I thought their strengths, we had a long-term experienced provider that was providing these services. I thought strength that and would be able to be an asset to Gilpin and Clear Creek counties, but I'm not sure about the MAC service we have. And I thought after the initial funding, they thought their alternate funding would be available from other sources. And in addition to some of the weaknesses that's already been spoken to, their certificate of good standing was over a year old. So with that, I will yield the floor back.
Sean.
All right, so I'm just going to go through strengths and weaknesses. I will admit that some of the prior reviewers have a more intimate knowledge with the area. So when I did this, I kind of took them at their word and wasn't able to account for some of the current providers that are already servicing the area. But with that being said, one of the strengths that I noted was direct response to a regional gap, that their proposal targets areas with extreme shortages in MOUD access. And given that the proposed Idaho Springs site would be the first medication unit in the county, I guess not counting the van that was mentioned, that it would address an unmet need. Second, strong organizational infrastructure and sustainability plan. Just with the numerous currently licensed OTPs that they have statewide, they've clearly demonstrated that they have the experience and capacity to successfully implement the expansion. Currently, they're contracted with all Medicaid rays and major commercial insurers, and that helps with enabling long-term financial stability and robust evaluation plan through use of technology. They detail a lot of objectives, staff roles, data tools, and security protocols related to their collection and evaluation of outcomes data. Weaknesses, let's see, lack of emphasis on community engagement. There's little detail on community partnerships, heavy reliance on key individuals. I mean, again, they've showed that they can demonstrate managing a large number of facilities, but from the bio sketch, it looked like there was going to be a few people with pretty heavy workloads and limited prevention or recovery focus. So although it does align with the treatment funding stream, they do not meaningfully engage prevention or recovery services beyond the clinical model, which they don't claim to do, but it was just worth noting. And with that being said, I feel like, again, with my limited research and data that I had, that this application should be funded.
And then we had some people yield the floor, so I'm going to add a minute to group discussion. The floor is open. Commissioner Del Kemper.
Thanks, Dr. Chelsea. I have a question for the reviewers. It seemed to me that based on some of the comments that you mentioned, Dr. Ryan, you had raised concerns about the high number of estimates in terms of people served, noting that the service was available in some places, not in others. Sean, you had just raised a comment as well. Is this a revise and resubmit? And I'm asking the scorers this question. Do we need to better define some of these areas and clarify before approving?
I would agree with that. Yeah.
I would second that. Again, I just took the information that was presented at face value, more or less, which is a learning experience for me. But yeah, it'd be helpful to see some of the considerations that other reviewers mentioned included
This is Bud, and I would concur with both those comments.
This is Janie. I agree with that as well.
Thank you.
All right, so I'm gonna assume that we can use the rest of the group discussion time to gain clarity on what that revise and resubmit should include. And what was, if you want to mention their major points of contention.
I think the first one is that there are no services currently in Gilpin and Clear Creek. There are, just clarifying what is there and what are they adding to that. Right, duplication of services that are poorly used currently doesn't make any sense. Is that something if they find that there are services here already that they would be providing, if they wanted to remove that from their application as an example, then and reduce obviously the ask in terms of financial amount.
Troy.
Coming from Gilpin County, they do set up a lot in Blackhawk, and their use, I'm talking about JCMH in the van that they park there. They're there regularly and are very approachable. I don't see a lot of business that comes and goes from that van, but we're very appreciative that they're there. My question is either partnering with JCMH. Do we know how long JCMH is going to continue this plan? I mean, there's a lot of things with JCMH that I don't have a lot of clarity on, but I do appreciate that they come up to Gilpin County, and it's not just Blackhawk. They'll go up to the courthouse too. So yeah, duplicating a service that is seemingly underutilized now. Is there a partnership available, or how long is that JCMH project going to continue if they can figure that out? I yield the floor.
Thank you. And then would it be fair to say that we want clarity around how they know 25 individuals exist needing this service?
Yeah, they stated that they were going to serve, I believe, 100 individuals in the first 24 months in Clear Creek County alone. Where did they get that number from? I'd be quite curious.
Yeah, I wonder if they built a facility or they got a facility in Idaho Springs, they were talking.
They would rent an existing building.
Rent one, yeah, for
Yeah.
$90,000 a year, whether it would be sustainable. There was no traffic. To have the staff and everything.
Okay. Is there any opposition to this application going into a revise and resubmit? Then the responses will be given to the executive committee by Thursday, end of day. It will be discussed in the executive committee meeting on Monday, and then we're allowing the executive committee to decide based on those responses whether it advances or that application is done.
My apologies, Dr. Short. I know you've got a lot of screens. You probably haven't seen my hand being up. Not opposed to a revise and resubmit. In addition, I would like to hear a little bit about the needs of a facility that they're thinking about in Idaho Springs. We've got quite a bit of on the ground knowledge that might help us understand the viability of this approach. If they were willing to share a little bit about what kind of facility they would need.
Okay. So I've clarified the services in Clear Creek and Gilpin and how this application supplements those services. A poor utilization of existing services doesn't mean we need to duplicate them. Specifically coordinating with the MAT JCMH van and Blackhawk, and how they can partner with the both Gilpin and Clear Creek corresponder programs. We would like to know how they came up with their service numbers of 25 individuals in a year, 100 individuals total. Do we know those people exist? really looking for a cost efficiency formula of the work. And then any outlines of the needs for the facility that they would have in Clear Creek.
So moved.
What?
So moved.
Yes,
You just-
okay.
As a motion.
And I'll go ahead and second that motion. I was just about to make one as well. Was that
Thank
Mike
you.
praying I heard in the background?
Yes, ma'am.
Great, thank you.
All right, vote by opposition to revise and resubmit. None in the room, any in the chat? All right. The next application is gonna be Empower. Our speakers are gonna be Elisa or Marie, Prang, Sean, and Amber Q. Empower Recovery Reentry Expansion proposal is seeking $1,626,371.01 to enhance services for justice-involved individuals in the region. Empower Recovery provides transitional housing and supportive services for individuals overcoming substance use disorder and those re-entering society after incarceration. The organization operates 6 locations in the Denver area and aims to expand its reach to address critical gaps in housing, transportation, and employment support. Key components of the application include the transitional housing, intensive outpatient treatment, vocational training, transportation services, and peer support. Their 4 primary objectives are to enroll 440 individuals over 2 years with a 70% successful discharge rate, to ensure timely creation of individualized treatment plans for all participants. 3, enroll 108 individuals in on-the-job training with a 70% success rate. And 4, ensure 70% of graduates remain relapse-free for 3 months post-completion. The program focuses on justice-involved individuals, particularly those transitioning from incarceration who face barriers such as housing instability, limited financial resources, and transportation challenges. Summary strengths of the proposal. It is a comprehensive service integration. The program offers a holistic approach to support individuals from incarceration to community reintegration. They have strong leadership, strong local partnerships, collaborations with local employers and organizations, enhance on-the-job training support, and they have a data-driven approach. The proposal utilizes local data to address specific community needs effectively. In terms of weaknesses and additional comments from the scorecards addressed in the narrative, number 1, capacity and scholarships. The scorecards mention concerns about reaching capacity and the provision of scholarships when that happens, but lack detail on how that might affect outcomes. The narrative addresses this by discussing the need for greater capacity due to the rising demand in the Tri-County region, emphasizing that Empower has successfully served justice-involved individuals, but requires more staffing and resources to meet the increasing need on page 12. The council can request a plan be outlined in contracting. 2, sustainability planning. The scorecards highlight limited detail on contingency and sustainability planning. The narrative mentions a 5-year sustainability plan, indicating that the organization is aware of the need for long-term funding sources beyond the grant period, page 17. The council can request additional information or request this be built into the contract and quarterly reporting. There's ambiguity in the rural strategy. The scorecards point out the ambiguity in the strategy for expanding into the rural areas of Gilpin and Clear Creek. The narrative does not address this specifically. The council can request a detailed plan be outlined in contracting. Budget clarity. The scorecards express confusion regarding the budget, particularly about the administrative cost breakdown and potential duplication of personnel expenses. The narrative does not directly address this confusion, but does provide a detailed budget breakdown in various sections, which may help clarify the intended allocations. I do not see any duplication of personnel expenses in the line item budget, but the council can always request additional information through the R&R or request a line item budget be provided at contracting. All awardees will be required to submit monthly invoices against the total project budget to maintain transparency and clarity around reimbursements. Generally, it's a good evaluation plan. The council is encouraged to allow me to do capacity building. Again, it's $1,626,371.01 over a 2-year period. I will yield the floor to Marie. And then you have 3 minutes if you want to focus just on the strengths and weaknesses of the scorecard.
Yeah, so I'll just go ahead and read what Elisa said in her application. She did score it really high, so clearly she liked it a lot. But her 3 strengths were that they clearly are already working in these areas with good success as noted by the clients they currently serve. The application is very thorough and detailed, has a good understanding of Gilpin's needs specifically. And then their goals are very specific and measurable, has ongoing sustainability after the funding ends as part of the plan. And then she only put 2 weaknesses. So she said they don't discuss reaching capacity, and that they provide scholarships. So when that happens, but not much detail about the issue. And then they only propose 1 additional employer. So will that cover the need? But yeah, that's what she wrote.
Kind of building on that too, they asked for 1.5 months of scholarships for every participant, but they already have signal funding likely for the same purpose. And there's not a single mention of Medicaid in their proposal. So their clinical and peer recovery services should almost entirely be funded by Medicaid. So it might be worth at least getting a revised budget from them that breaks that down.
Great. Okay, so this is a reentry program that has been established for a number of years. It's borders Jeffco on the east side, does not expand currently into Gilpin or Clear Creek. However, the structure that's in place organizationally has been successful. There are, within the application, their goals are tangible, easy to understand and follow. The components of the program with the OJT training, in-reach, reentry programs, which I believe Jefferson County Jail, we do have worked with this program before, continuously actually. The door-to-door transition from a detention facility, then clinical, peer, and employment support. I think that this program, based on my understanding of it, is it's because of these components and many of their brick and mortar facilities that allow some diversity in services that complement each other. Currently, they've shown that they can meet staffing needs, so they are able to find staffing, identify participants, and then they have the infrastructure, as I mentioned earlier. I think and it's already been discussed, but the sustainability challenge is going to be the funding. They spoke to that, but again, that's going to be their most biggest need when it comes to sustainability. And they mentioned expansion into Clear Creek and Gilpin counties, and they specifically talked about the door-to-door transition from the facilities to be able to transport from those detention facilities down to eastern side of Jefferson County. But fundamentally, what they're asking for is to expand west, deeper into Jefferson County, and then also into Gilpin and Clear Creek. Now, I'll speak from a point of experience. Strong reentry programs are essential for individuals that are transitioning from incarceration. And arguably, is these highly effective, if they're highly effective reentry programs, they will have a significant impact on reducing recidivism for the individuals that need these services. So I yield the floor.
Sean.
Yeah, I'll just quickly piggyback on what was just said, because that's like the top strength that I noticed, or that I noted, was just the truly wraparound model that they've been successful with, that bridges the gap from incarceration to community reintegration. And if they've shown to be able to do that and can expand on that, I think that would have a tremendous impact on the community. Second strength that I noted was vocational partnerships and on-the-job training that they talk about. Yeah, just reading through and doing a little bit of research about what they've been able to do there and what they're proposing is really impressive. An impressive part of their program, their partnerships established with established employers and the Cornerstone Community Outreach for Job Links scholarships provide participants with real employment pathways, which is critical for this population. And they also had demonstrated strong use of local data and needs alignment. They make excellent use of recent Jefferson County data detailing overdose rates, justice-involved homelessness, and transportation barriers. The program is clearly tailored to address the gaps locally, especially in rural Gilpin and Clear Creek counties. Weaknesses, I noted this in the last one too, but just there seems to be like a very heavy reliance on existing leadership and staffing and just expanding roles on a small core team, which I understand for a short term, but as far as long-term sustainability, it can create problems, especially if there's any turnover. Limited detail on contingency or sustainability planning. That was already kind of mentioned, but just would be good to see more detail on how they'll secure and diversify long-term funding streams outside of philanthropic hopes. And let's see. Oh, that's not. So yeah, I did propose that in my suggested funding motion was to fund at a lower not the full amount, just based off of the available funds. I think this would be like over a quarter of the available treatment budget, which seemed like a lot given the their scope and the strength of some of the other applications.
Amber.
Yeah, a lot of comments I echo, not only sustainability, but of funding, but also how individuals who are receiving services through this door-to-door and desire to continue to live in the community of Gilpin or Clear Creek County, what would be established in their own community to maintain long-term recovery. A lot of it was focused more in the Denver metro area and resources there and on-site job training in those areas. With transportation provided, again, door to door to access those, but in the longer term, it was unclear how that was intended to scale. Also, identification of the desire to expand and scale and establish MOUs and partnership, but I didn't see many specific specificity around like who that would be. I know letters of support were not required, but I didn't see necessary letters of support or any key stakeholders in those communities representing the need. Yeah, I think there was just a little bit more of a desire to see more details in the budget when asking for 1.6 million in a 2-year spend. There was some confusion and some lack of specificity in their budget line items. Now yield my time.
All right, I'm gonna put 5 minutes on the clock. The floor is open. Dr. Ryan.
Thanks, Chelsea. I would say this across the board with any grant application from the ones we're reviewing now to the ones in the future. Clear Creek and Gilpin County, I think it's important for everyone to understand that we're willing to work with everyone, right? Every opportunity, but doing so beforehand, before submitting a $1 million, $1.5 million, $2 million grant application, as we saw with the first round of applications of hoping for things to happen, and then it takes them 6 months or a year just to get the basics done. I think having grant applications where that's done in the front end, and those conversations are had with the people that are relevant to those conversations is critical. And I think maybe moving forward, I might suggest that we do have letters of interest or letters of whatever you want to call them so that it is clear when we're spending all this time on grant applications and reviewing them, that these have done their homework. They've already had the conversation with Clear Creek County Sheriff's Office, for instance, to understand how many people that are discharged from there actually live in the county and are actually intending to stay in the county. Because if it's 5, that's a very different outcome than 105, right? And to have that sort of information in these applications where they're asking for significant money, I think is very important. And I think it will save all of us a lot of time, right? And Gilpin and Clear Creek, we're very much willing to work with any partner. But having those conversations before you submit your application is absolutely critical.
Yeah, and I'm just gonna pause the clock because we do have time. So I think we do have the letter of support and the letter of acknowledgement, and it was stressed numerous places in writing, on recording, that if someone wanted to expand into a service area that they were not already in, that they needed a letter of acknowledgement from someone. Some councils do have policies against contacting voting members. So I'm just wondering if there was like some confusion and apprehension in that. I have drafted a 2-phase application process that requires a letter of intent. And then the committee will review those 1-page letters of intent and then invite people to apply, and we'll have a designated window that those conversations can happen without creating a conflict of interest. But that's a future solution. I know that doesn't solve the problem now. The floor is still open.
I mean, that's interesting, because then if they didn't submit a letter of acknowledgement, is their application complete? I don't know. I know.
Yeah, because we didn't require it this time. And so in the future, the draft is they do the letter of intent and we view it's 1 page. What are you gonna do and how much are you asking for? And then that way the committee can say, okay, we want to invite these 10 people to apply. We already know where the conflicts of interest are gonna be. We'll have a designated window for applicants to have conversations with voting members that doesn't create a conflict of interest, and then they can't have conversations outside that window. Again, that's like a future solution.
Looks like I think Commissioner Bartlett's hand is raised.
George.
Yeah, thank you. This is clearly an application that is aiming to provide a service gap, a known service gap. I think in the least, I'd like to see us do a revise and resubmit. Some of the questions I have are sort of a repeat of questions in the past, from the past application. I presume there should be some Medicaid eligibility from the population they're serving. I'd like to see that reflected in the budget. So I'll put that one out there as a starting place and probably just stop talking.
Amber.
On the subject of budget, I was going to say too, it'd be helpful to see a breakdown by service area, because it would be one thing if their proposal was asking for funding to enhance and improve what they're already doing in Jefferson County, already established partnerships, already in proximity to many of the partners. But yeah, the budget was unclear to know what the spend would be for Jefferson County versus this effort to expand and scale into Gilpin and Clear Creek. That kind of relates to my comment of the specificity of the budget. I think that was a bit lacking for this amount of money requested.
So for a formal revise and resubmit, that we need a line item budget. What is billed to Signal? What is billed to Medicaid? What is participant self-pay? What is their full operational budget? And what is just their Region 10 specific budget? Then we would like to see an alternative reduced budget, building on Sean's suggestion to fund at a lower rate. We would like to see memorandums of understanding or letters of support from collaborators, especially jails and local sheriff's departments. And if they have not had those conversations, we would like to know that. And then we would like them to clarify their rural outreach plan. And so their data states that 29% of their participants are from Jefferson County and 40% are from other locations, but there's no description of how they focus on Region 10. So we would like, again, just clarity around that rural outreach plan between the 3 counties. Anything additional? Is there a formal motion to revise and resubmit, not advance or advance?
This is Leslie. I'll go ahead and make a formal motion to revise and resubmit this proposal.
This is Bud, and I'll second that.
Vote by opposition in the room or in the chat.
Does it look like Dr. Ryan's hand is up?
Dr. Ryan, is your hand still up? All right. I'm gonna assume that's rolled hand. And this application will go to R&R next Monday, and we are gonna head into our last application, Lakewood Police Department. Our speakers are George, Kevin, and Barb. We have to go with flags, that would have each thing. Not for nothing. Sorry, folks, I'm just trying to get this. My last, do you have it? Yeah, thank you. Oh, just kidding. All right, so the City of Lakewood Police Department is requesting $523,944 for a co-response program. They are seeking funding to hire 2 licensed clinicians specializing in substance use disorders to enhance their co-responder program. Currently, the department has 2 co-responders and 1 case manager handling over 2,000 calls annually, with approximately 20% or 400 calls specifically related to substance abuse. The proposed clinicians will assess treatment needs and connect individuals to appropriate resources, aiming to reduce incarceration and mental health goals. Additionally, they will improve data collection for this demographic. The primary goal is to increase access to treatment recovery services while reducing harm and connecting individuals with appropriate resources. The project aims to enhance immediate access to treatment through trained professionals, support recovery-oriented solutions with follow-up and warm handoffs to treatment, divert individuals from the criminal justice system, thereby lowering recidivism rates, and alleviate the burden on emergency services and law enforcement. The project will serve the diverse population of Lakewood and Jefferson County, which includes a significant number of individuals experiencing homelessness and substance use disorders. The demographic profile reflects the city's overall population with a focus on vulnerable groups, such as low-income individuals, racial ethnic minorities, and those with co-occurring mental health disorders. Summary of strengths. They have specialized expertise. The addition of licensed clinicians will provide essential resources and treatment for individuals with SUD. They have an evidence-based approach, and they have an existing framework is already operational, allowing the expansion that can reach more individuals in need without further involvement in the justice system. Weaknesses. Justification for 2 clinicians. The scorecard questions justification for hiring 2 clinicians, especially given that only about 400 of the 2,000 calls are substance use related. The narrative states that Lakewood's limited capacity often means that clinician and caseworkers do not have enough time to bridge all of the gaps seamlessly and continuity of care. The additional clinicians would provide capacity for follow-up, monitoring, and connecting people with resources before they reach crisis. SUD specialists will provide the time and expertise needed to connect people to MAT services, sober living, residential facilities, detox, and other. That's on page 8. The council is also encouraged to consider the typical 40-hour work week and that a single clinician cannot cover all the hours in a day or week. Some calls may occur outside one clinician's schedule, or an influx of calls might prevent follow-up work with clients. There's a vague evaluation plan. The narrative discusses the need for additional capacity to improve data collection. So they acknowledge that that's a shortcoming, and that's where this additional support will help. It's also worth noting that co-responder programs typically have a data output that is submitted with their quarterly report. All awarded co-responder programs, including CHAT and Gilpin, will have a meeting with me to discuss the alignment of metrics and how they align across programs and with whatever system they're using. See my additional comments in the next section regarding the evaluation plan. There is a lack of collaboration with Jefferson County Sheriff. The scorecards note there is no emphasis on collaboration or resource sharing with Jefferson County Sheriff. The narrative mentions that the expanded co-responder team will collaborate with organizations like Community Medical Services and Jefferson County Mental Health, indicating a focus on partnerships to enhance services on page 8. The council can conditionally fund the applicant and stipulate a partnership with Jefferson County Sheriff be outlined in the contract as well as addressed in quarterly reports. Generally, this is a decent evaluation plan. I do encourage you guys to allow me to do capacity building and work with their specific program. Again, it's $523,944 over 2 years. George.
Yes, thank you. That's a really good summary. I don't think I have much to add. I would point out that they do have a specific goal and a specific identified shortcoming. They're unable to respond to 40% of the cases in which substance use disorder is a primary issue. They think they can cut that in half and improve case management. I think that would be an excellent outcome for the people of Lakewood. I was the reviewer that commented on collaboration with Jefferson County Sheriff's Office. At the time, I believed Jefferson County Sheriff's Office had a co-responder program. I'm not so sure about that anymore, given their application for funding for a co-responder program, but not this application.
Yeah, you can speak to that.
And I was compelled by the story about Lutheran Hospital moved to Golden. New management is unwilling to partner with West Pines Treatment Center. So there is a gap and there's a need for somebody to provide a direct handoff in a way that used to happen and isn't happening anymore. That was compelling to me.
And just to speak for the sheriff's office, currently we do have 2 co-responders, and we collaborate with an MOU with JCMH, but that MOU is going to end, and that relationship will be July 1. I do not have any details further than that.
Do you yield the floor, George?
Yeah, that's all for me.
Barb, I'm gonna go to you.
Yeah, I don't have a whole lot more. Chelsea did a great job of summarizing all of that. I was more pleased to hear your explanation about how you will engage them in the evaluation and the metrics, the outputs. That was probably the place that I was most concerned about in this application, but I am in support of it. It is something to expand the current need. So yeah, I yield the floor.
All right, and then Kevin's not here, so sorry you have to hear my voice again. So Lakewood Police Department is requesting to hire 2 licensed clinicians specializing in substance use disorders to augment their co-responder program. They currently have 2 co-responders and a case manager with over 2,000 annual calls. The fully licensed clinicians would be used to assess the treatment needs of these individuals. The hope is to connect them with appropriate resources. They would also assist in improving data collection for the group. Only 2 strengths were identified. The need for specialized clinicians in substance use disorders is important to provide the appropriate resources and treatment. Evidence has shown individuals who experience a mental health crisis resolve to using illicit drugs or prescription medications as coping techniques. 3 weaknesses. The weakness to this grant application is the justification for 2 clinicians. If there are approximately 20,000 calls for service for co-responders and 20% or 400 calls are substance use related, they currently have 2 co-responders and a case manager. Lakewood Police Department has done well identifying the need for a full-time licensed clinician and specializing in SUD. I recommend funding for one position, not two. If they can show a need with better statistical data, I would recommend them applying for the next grant cycle for the additional position. And then I'm gonna put 5 minutes on the clock. The floor is open for group discussion.
I would want to ask a question about the need for the two caseworkers instead of one, and whether one would be adequate at this time. Are they coordinating with Recovery Works for the caseload at all? Or any other, just
So that they might not be at this time, but all awarded applications will be required to participate in quarterly learning forums for them to network with each other. So hopefully that if they're not partnering, that can all of, even advocates for recovery, they'll all start partnering. Like we're gonna start building that resource network. George.
Just to provide some context, Clear Creek's co-responder program aspires to have 2 licensed social clinical workers. The unincorporated population of Jefferson County is 200,000. I was really, when I was talking about this interaction with the sheriff's office, we believe one county-wide program can adequately serve in Clear Creek. I'm not sure that's the case in a county like Jefferson.
Chelsea, I'm so curious. Does it say in the application? I thought the clinicians that Lakewood had on staff were through GCMH. Is that not right? Are they all under Lakewood PD?
I thought it said that they were gonna hire in-house. So on page 8 of the narrative, under the description of proposed project scope, that second paragraph makes it sound like it's in-house. But we can ask that clarity if they partner with JCMH or the hired clinicians would be in-house.
But currently these are in-house.
Just to use our time efficiently, is there a motion to do a formal revise and resubmit so that we can focus our time on what we want that to look like?
I don't know that revise and resubmit is the right approach here. These questions aren't going to affect my desire to fund. They might change me from partial to full or something, or inform contracting, but I would make a motion just to advance this application.
Yeah, to me, these seem like an email, not a document, so I could get that information really easy for the June 23rd meeting.
I agree. I'll go ahead and second George's motion.
All in favor of advancing the application or opposed? All opposed to advancing the application straight to June 23rd? Nothing in the room, nothing in the chat. All right, this application has advanced. At home can't see the struggle. All right, so we have Recovery Works is advancing to June 23rd. They have an informal revise and resubmit about just selecting participants, making sure that they would serve people in Clear Creek and Gilpin as well. We have a formal revise and resubmit from Denver Recovery Group, a formal revise and resubmit from Empower, and Lakewood PD did advance to June 23rd. They have an informal R&R about whether their staff would be JCMH or Lakewood PD employees. All right. Wow, we're getting so efficient at this. Yay. Okay, so meeting forecast, May 19th is an executive committee meeting that is entirely virtual. We'll go over those 2 revise and resubmits requested today. June 9th is a hybrid in-person preferred meeting. We're going to talk about recovery. Oh no, that's virtual only. Just kidding. Virtual only, we're going to finish our group discussions with the last 4 applications. June 12th is an executive committee meeting that's virtual. We're reviewing the revise and resubmit requests from June 9th. And then on June 23rd, that is our final day. We are going to go over budgets and rankings and final award decisions. As always, if you have any questions, comments, or concerns, please reach out to me. I'm here to support you. The Clear Creek booklets for today and June 9th have been given to Janine. So the Clear Creek folks can pick that up. The Gilpin packets are with Jeff, so he will have those at your board meeting tomorrow. If there are any other packets that are needed, please let me know. Have a great day, everybody.
Thank you.
Look at us getting out 30 minutes early.